How does someone choose between open surgery versus more minimally invasive surgery? Well, let's say 15, 20 years ago, most surgery was more open, and that's the way traditional training has been. However, with advances in techniques of not only diagnosis, but also the techniques that we have for surgery, we can get a more precise diagnosis and then, almost like a laser beam, focus in on what needs to be done. And once we can determine, let's say someone has a 1 or 2 level disease, meaning they may have a disc herniation at one level, or they may need to have a stabilization like an artificial disc or a fusion at one level. If we'd have that precise diagnosis, then we can do surgery very precisely, which allows us to do a smaller incision, so that way I can do a minimally invasive surgery where someone's up walking the day after surgery and up walking the next day, and hopefully get all the pressure taken off the nerves with a smaller surgery so that there's an easier recovery period. So that's the whole goal of minimally invasive surgery. And even today, even if someone needs a larger surgery, I'll still use the minimally invasive techniques so that I don't have to worry about cutting muscle. I can work between muscles. I can elevate instead and separate, as opposed to take a lot more tissue away. So the less invasive surgeries often can actually do more because we can visualize better. And we also have the more precise diagnosis from MRIs and CT scans and injection information. So all of that allows me to do more minimally invasive surgery so people can get up moving faster.